Alright, so I've already numbed you up. We want to make sure that we don't feel that. Nope. So let's do another look here. So this is a hammer toe. It's a rigid hammer toe. Sometimes called a mallet toe. But what's happening, I've already done this toe. These toes have not been done. We just did this toe a second ago. I put iodine on here. But when I load the ball of his foot, we can see this toe, which has already been done. This toe used to do that. I released it, it stopped the pain. These two toes are gonna be done. We're gonna do this one today. We'll come back and do those in another couple weeks here. But if we look at the side profile of that toe, it just mallets into the ground. We wanna do a flexor tenotomy, release that tendon, and that toe won't pull like it does. Also because of the deformity of the nail here, we're gonna remove the nail, a new nail will grow back out, but there's this hematoma abnormality just for that petechial hemorrhaging because of the chronic tapping of that toe. So we already kind of cleaned it up. It's been numbed up. We know that because you're gonna pinch here, we don't feel anything. Flexor tenotomy is a great procedure because it's not invasive. You don't need to use a tourniquet. I'm going to use an 18 gauge needle. I'm going to come in through the side of the toe, and this 4x4 here is just to catch any bleeding that might happen. I'll go ahead and ask you to go ahead and bend your toes down. Not too tight here, just to relax just a hair. Yeah, that's going to be in the way. And if we come in through the side, if we listen really carefully, we'll actually hear the tendon. There it goes, it just released. And we're going to see an instant transformation of that toe. You'll notice it's not even bleeding because I didn't hit any vascular structures. But now when I go to load that toe, you see that that toe doesn't hammer like it used to. Now it just wants to straighten out comparatively to that toe. And so, wonderful, wonderful procedure. We're now going to go ahead and pull that nail off. And for that I am going to use a tourniquet because that does want to bleed a little bit sometimes. On the nail avulsion here, I'm just going to free up the cuticle. Just come up underneath there. I'm just going to grab one little corner right there to get a hemostat up underneath. So grab that. And this just pops out and off. And we're going to pull off all that dead skin too, so that we can see if we can get a normal nail to grow back. Sometimes there's some fungal aspects. This might have it. That nail, the skin is kind of funky here. We're going to peel all that dead skin off. With some betadine, a little 4x4 gauze wrap. Straight to that. This is a wonderful little procedure. It's done here in office. It's non-invasive, provides excellent outcomes for those pesky hammer toes. Because now as the toe loads, again, it doesn't hammer in the ground. And we'll come back and do this one here in about 2 to 3 weeks. So, all right.
All right.
We're good.
Good job, man.